I'm Jennifer Sorensen. I'm a registered nurse in our education department at Sarasota Memorial Hospital. Sarasota Memorial Hospital is adapting masking guidelines to care for our patients and protect our employees as well as the community. As many of you in the community are choosing to wear masks, we want to ensure that you are wearing them properly. Here are some important tips while wearing your mask. Never touch the outside of your mask while your mask is on your face. The mask on the outside is considered dirty. Don't pull your mask below your chin while you're wearing it and have it sitting down here. It should always be fitting properly on your face. Third thing, you don't want to have the mask dangling. You don't want it sitting like this. All of these are going to create opportunities for cross-contamination of yourself or other surfaces. I want to cover a few simple steps to keep yourself and others safe while wearing your mask. When you first go ahead and pull out a mask, we want to make sure we identify which side of the mask is the outside of the mask, because the outside of the mask, again, is dirty. Here at the hospital, we're marking the outside of the mask with our initials. For you at home, you may choose to do the same. Or you could put something like a star, some type of mark identifying that that's the outside of your mask, because you can see it's the same color on both sides. So that's going to identify that that's the outside of our mask. The second thing, whenever we're taking our mask off, we want to make sure it's put into some clean type of area. We want to store it in a clean area. Here at the hospital, we're using a paper bag. At home, you could use a paper bag as well, or you might choose to use something like a Ziploc baggie. What we don't want to do is put it in an area that's not clean. An area that's not clean would be something like our purse or our pocket. So I am going to go ahead and put my mask on. So to put my mask on, I want to pull it down, make sure it's covering under my chin, make sure it's covering my nose, and make sure it's on nice and secure. So again, I'm not going to touch the outside. I'm not going to pull it below my chin. Okay? I need to now remove my mask for whatever reason. First thing I'm going to do is clean my hands. So I'm going to perform hand hygiene. I can do that with soap and water or hand sanitizer. When I remove my mask, I'm going to do that from a clean area. So I'm going to remove my mask from the ear loops. I want to inspect this mask to make sure I can reuse it. So has my mask been compromised at all? Is it wet? Is it visibly soiled? If it is, I want to go ahead and I want to throw it away. I would then go ahead and perform hand hygiene, wash my hands with soap and water, or again, using my hand sanitizer. If it's okay to reuse, I'm going to go ahead and I'm going to fold over my mask. I'm going to fold it in half and folding it so the outside surfaces are touching each other. And I'm going to place it carefully into my clean storage. If it's a paper bag, I want to seal it over, so fold it over. If it's a Ziploc bag, I would go ahead and seal my Ziploc bag. Perform hand hygiene, because I still touched probably some edge of my mask that was potentially dirty. And now it's in a nice clean area. To reapply my mask, okay? So to reapply, I would probably wash my hands first, perform that hand hygiene, open up my bag. When I first go to grasp it, I want to grasp it from the ear loops. I want to look to find where is the outside of my mask. Where are those initials? Where's that mark? Because that's the outside. Putting it on by the ear loops. Okay? And trying to use the ear loops to kind of get it tucked under my chin. And then you're going to kind of need to secure it to your face. So you are touching the outside of the mask for a second. So then again, I'm going to perform hand hygiene. Wash my hands with soap and water, or again, use my hand sanitizer. And I'm ready to go. For the employees at the hospital, at the end of your shift, at the end of the day, you would remove your mask and you're going to throw it away at the end of your shift. Those are our tips for ensuring that you are utilizing proper masking guidelines. Thank you so much. Stay safe and stay healthy.